Welcome back, viewers, and if you're just joining us, this is the Wholly Healthy Show. Now, in our previous segment, we have talked about communicable diseases. Now we are in our second segment where we're going to be looking at the non-communicable diseases. I hope you're learning a lot because this involves all of us. So back to you, Mr. James. Take us through the non-communicable diseases.
Thank you very much. And before I go to the non-communicable disease, I also need to mention something about the communicable or contagious diseases, that the prevention is basically lies on hygiene. If hygiene can be, if we can take care of the hygiene well, it reduces the rate of the communicable diseases. So by keeping hygiene in our places, then we are going to reduce the risk of communicable diseases. Now, straight to the non-communicable diseases. We normally call them the non-communicable, as I said earlier, because you cannot, they are not transmitted from one person to the other. Basically, we call them chronic diseases. Most of them, basically all of them, they are long-term diseases. And we can say we have the four main, and those are the cardiovascular diseases, that is high blood pressure, and also we have heart attacks. Those lies under the cardiovascular, and you know the cardiovascular is cardio is the heart. So those are heart-related conditions. So we also have the cancers. We've seen in the current society that cancer is one condition that is all over. The prevalence has gone very high. And cancers, we are talking about all types of cancers. We have the prostate cancer, we have the cervical cancer, we also have the breast cancer as well. And we also have the COPDs, those we call them pulmonary obstructive diseases. Those are the diseases that affect the respiratory system. Under that, we also have asthma. And also we have conditions, we have the last one that is diabetes. So if you look at all these conditions, they have the specifications and the specific organs they have on. So those are the four main types of the non-communicable diseases.
So I just had you mentioning a very technical term, which I'm sure our viewers out there may not have really understood what it meant. Something to do with COPDs?
Yes. So basically, COPD is an initial of, it's a long word when we start getting deep to these medical jargons. Yes. COPD, we say it's chronic obstructive pulmonary disease. And when I say pulmonary, I'm referring to the respiratory system. So these are disease, these are condition whereby the patient is not able to breathe well, and it's like the system has been obstructed, hence the COPD. So basically they are as a result of mostly those people who smoke, and it affects mostly those people who smoke, though again even it's just a condition like we have asthma. So basically it's having difficulties in breathing, hence the patient strains to the body doesn't get adequate oxygen, hence the patient strains a lot. So the airwaves are blocked and it becomes a challenge to breathe. Yes.
Okay, so these non-communicable diseases, of course you said that these are diseases that are not transferred from one person to another. These are diseases that just develop from within a person. When we look at something like these chronic diseases, something like cancer, something like the sexually transmitted diseases, we know of how the society of today is, that people are using so much money in treating diseases like cancer and everything. I was doing research the other day and I found out that there was a clip, an international clip where they were talking about foods that you can eat to prevent or maybe to make you live longer regarding the disease that you're suffering from. How true is that?
Well, some of this information they are not confirmed reports, because there is no way we can really say that if you eat a certain thing you will prevent a disease like cancer. And the science behind conditions like cancer, it's very complex. You cannot just say by eating a certain food you will prevent. However, we cannot deny the fact that most of these conditions are lifestyle induced. So the best way to prevent this condition is just by changing our lifestyles. That is the best way, because when we shall be discussing about the predisposing factors that lead to these conditions. And if we look back at the factors we were talking about, good health, you find that the non-communicable diseases, they all lie under those clauses of not watching those factors that enhance the good health. Yes.
Somebody who may not be in a position to access the medical facilities, what will you advise them? Probably somebody has a child who has asthma, or maybe in their family they have somebody who is suffering from this kind of disease, but then they find it so expensive to buy those gadgets that are needed in treating, or rather in helping one manage this disease. What advice would you give them?
I think the only advice I would give them is for them to seek the proper health care from an institution, because in short, there is no shortcut to that. There is no alternative to getting proper care. That one, there is no other way, because we cannot go to in the traditional ways when we have the modern ways of managing these conditions.
So you've been in the health board for quite some time now, and what you do most is when you carry out tests to patients, at least if somebody is suffering from a certain disease, you're able to detect. Like for example, cancer. Are you able to detect somebody who is suffering from cancer?
Basically, these are tests that are done in labs, and as I said, my practice mostly is in pharmacy, and for us we just do those simple tests, the blood pressure, and the blood sugar tests. Those are the simple tests that we are able to carry out. Any other complex test, it's done in a laboratory, and of course these conditions are diagnosed by the right professions to manage those conditions. Yeah. And here we are talking about doctors and also physicians. Yes.
What about the case like the asthma? How can one detect that they're suffering from that disease?
Asthma is very observable because you find the patient will be straining.
Straining like to breathe?
Straining to breathe.
Okay.
And at times they get those attacks. And it's the way like we are breathing normally, then all of a sudden someone blocks your nose. So all of a sudden you be denied the air. So there are those attacks that the patients with asthma, they always get those frequent attacks. So asthma is one condition that is very easy to detect, even with children, because you'll be seeing that strain. And also there is a wheezing sound that they produce, because when they are blocked, now they are trying to strain on how to breathe. Yes.
That is wonderful. I hope you're really learning a lot, like I am learning. We are talking about non-communicable diseases, and we have really looked into some of them, some of their symptoms, and I am sure that you're able now, you can detect if you have a certain disease, and you can be able to categorize if it is communicable or non-communicable. Now that brings us to going to a short break, but when we come back, we're going to be looking at the risk factors involved in communicable and non-communicable diseases. So keep it Champions TV.